Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. And today we are honored with the great guest, Dr. Shehzad Pervaiz, with us. He's infectious disease and very well experienced with dealing with infections. So let's welcome Dr. Shehzad. How are you, sir?
I'm fine, thank you. Thank you for inviting me to your forum.
Yes, thank you for coming. And as we are dealing with COVID-19, and I'll just copy these new numbers, and these are from CDC guidelines or CDC website. So they are saying these are the average daily cases in last 7 days, 56.7, total deaths 330, and this is the map they are giving for the USA. And as you can see, these are the color graded from green to blue, and these represent different numbers, average cases per day in 7 days. And these are the statewide. And if we look at Virginia, it's 44.7, and looking at Maryland is 38.7, Washington D.C. I think probably is higher here. So let's. What do you say about COVID-19 right now? Where are we? What is your assessment, sir?
No, as you heard, everywhere, there's some light at the end of the tunnel.
Mhm,
And since we have the very good vaccines, the Pfizer vaccine and the Moderna vaccine,
mhm,
and we're now in Group 1A, so we're going to try to immunize the long-term care and the healthcare workers. So that's the first phase.
mhm,
You know that we are seeing a surge in COVID-19 especially in California and other places we didn't have COVID before that much. This is because of the post Thanksgiving, people came and met.
mhm,
There was no social distancing. I don't know how many people are wearing masks.
mhm,
I just told my wife went to pick something up at Tyson's Corner Mall in Virginia.
mhm,
And we went to pick something up that she had ordered. And I was surprised that the mall was full. People were wearing masks, but they were sitting in a table across each other. And so these are kind of a little bit risky behavior.
mhm.
We might see a surge again. Usually takes like 2 weeks after the holidays, after Christmas, you'll see a surge of COVID cases.
Mhm. So what you're saying is these surges we are seeing because of the problem with Thanksgiving, and now maybe there will be another peak on peak coming with Christmas. Unfortunately, people did not, listen to a lot of providers.
Yeah, the CDC, NIH, Dr. Fauci, has been telling, that please don't get into big gatherings. Try to stay isolated. I just seen him telling, that he's gonna do Christmas by Zoom with his other family members.
Mhm,
And I think there was in the news that 84.5 million Americans traveled this Christmas holidays.
mhm,
So there's a potential for spread, with traveling.
mhm. So tell us about vaccination, and we will talk one by one. I have few questions from the audience. They already sent me a few questions. So first of all, in phase one, all the healthcare providers, and I got it, and I posted that picture. We want to encourage a lot of providers and everybody to get the vaccine. So that is phase one, but it's followed by it'll be anybody over 75, right?
Yeah. Phase one is basically the healthcare workers and long-term care residents. Because if you look at the data of the deaths from COVID-19 in the United States, 40% were from long-term care.
Mm-hmm.
So that's a big portion of the deaths, because they have the most vulnerable population with the elderly, with comorbidities.
Mm-hmm.
That's why CDC and ACIP and the FDA, when they get together, they decided to let's target this group first.
Mm-hmm.
Now, phase 1B is, as you said, 75 and older, but they also have essential healthcare workers like postal services, grocery workers, people who work in public transit, teachers and daycares.
Mhm.
personnel. So they are the phase 1B, and also as we said, 75 and older. And 1C is from 65 to 74, and those who are between 16 and 64 and have other underlying medical condition, and other essential workers will be included in 1C.
Mhm.
So the next, after these are done, then by probably March, April, they're gonna start doing the general public
Mhm.
vaccination. Now we have to remind, we have very good vaccines, with very great efficacy, like 95% efficacy, 93 or 95% efficacy of both vaccines. The
Mhm.
FDA said, according to FDA, if you have a new vaccine and they give what they call an EUA, emergency use authorization,
Mhm.
and their cutoff is 50%. So this is very remarkable that we have really good, strong vaccines.
Mhm.
But the other thing that we have to remember is to get the virus under control to prevent further transmission. We have to get 75% or 70 75% of the population vaccinated to get the herd immunity.
Mhm.
So that's the next challenge. It's not to just give vaccine to a couple of people, but we have to get the big population
Mhm.
vaccinated.
Mhm. So, and that is so true that, the vaccines work off herd immunity. And so, a couple of things very important for audience is don't get vaccine and think that you're immune and everything is good and you are partying. So, this is not a license to party for sure. You know, it is, once you get the herd immunity, and even then you have to be careful. So, a lot of unfortunately, a lot of people were posting, let's get the vaccine and passport to party. So that, you know.
Yeah, yeah, well, Dr. Moby, you're right. I think you read it well. You said it well. Because what happened was in the Pfizer trial, they had like for the Pfizer vaccine, the vaccine has two doses, and the doses are um, uh, 3 weeks apart. Okay,
Mhm.
so after the first dose, they looked at the efficacy. Between the first dose, after the first dose, it was like 82%. And between the first and second dose, it dropped down to 52%. And after the second dose, then you have to wait for 2 weeks to make the antibodies. It went up to 95%. So even the CDC is saying that even if you get the two doses of vaccine, still you have to continue your social distancing and wearing your mask, because we have to make sure that that everybody, when everybody gets vaccinated, we have the herd immunity. Then we can start loosening.
Mhm. So important thing is to, even after vaccine, keep wearing masks and keep your physical distances. And I try not to use social distance term because socially you should not distance. Actually, you should call each other, but don't party. Don't physically shouldn't be close to and each other. So socially, we should still take care of each other, calling each other, and making sure everybody's okay. So I think I like that term better. But
Yeah.
also, tell me a little bit. We have few questions. One is, when somebody gets a flu shot and got this other COVID shot, what should be the timing between these two?
Um, so for the flu vaccine, I think um, uh, because the vaccines are not live virus
Hmm.
for the COVID, it's like a messenger RNA.
Yeah.
So it's not like you're giving two live viruses together. So technically, there should be no problem. But usually, they have to give it. Sometimes you want to give it apart, to make sure that there's no, whether one vaccine is causing some side effects
Mhm.
between each other.
Yeah.
So
Yeah, I think just for a safety profile, maybe, so if you develop reaction to one or the other, then at least you have some distance. So they were recommending anywhere 2 weeks to so roughly about. So that was one I think some suggestion I read
yeah,
somewhere.
yeah,
Also, there is for our audience to remember is there is a misconception that somehow we'll catch COVID from this vaccine. So this does not happen. So number one thing is this not a live vaccine. It does not have anything to do with the virus being live there or not. And it is a new technology, relatively, speaking, because older vaccines were developed by just, injecting the fragments and then neutralizing antibodies. Those were, kind of worked into the vaccine. But this is a new technology. Messenger RNA means that basically we're getting the blueprint and telling the body to make those proteins, which can really work very well for our body. So, having said, so this is a new thing. So now a lot of people have anxiety about messenger RNA, that they might become mutant or develop things. How true are those?
Well, the technology has been known for like 10 years. It's used in cancer therapy before. So the thing is that the messenger RNA, it goes into the doesn't go into the nucleus. The cell has two parts. One is cytoplasm, and one is nucleus, where you have your DNA, where you have your chromosomes. So this messenger RNA goes into your cytoplasm, and it makes goes to the ribosomes, and it makes that spike protein that's is same as in the coronavirus 19, and that it elicits your immune response. So it does not go into it degrades. It doesn't go into your DNA, into your cell, the nucleus. So it does not integrate at all to your DNA. So that's the thing about it.
And so that is then a false assumption that is can mutate somehow. The other thing, it does not remain too long in your system, is degraded pretty quickly. So once the protein starts appearing on the cells, and then the body reacts to that, spike proteins we're talking about, the ones they thought is responsible for these immune response to the virus. And the other questions I'm getting is about the mutation. So there is a mutation, of course, happening all the time, which is not unusual. Viruses always mutate, you know. Normal cells mutate, even so, but the rate of mutation depends on, the various organisms. So, what do you say about these mutant variants?
So you've heard about the mutant that's in Europe, right? That was in the news also. So there's a mutation with called the D614 mutation. Now the thing is that there's some bad news about it and some good news. The bad news about that mutation is that when they checked the virus, that mutation, the viruses of coronavirus, which had that mutation in hamster cells in the lab,
Mhm.
it replicated more in tissue, and it replicated more in the lungs. There was more replication of the virus. But when they checked the antibodies for the regular virus, it did the regular antibodies, kind of killed that virus, or like deactivated the virus, and didn't allow it to infect the cells. So that's the good news.
Mhm.
So mutations can happen, as you said, but so far, what we know is that that mutation that happened, the vaccine will probably work against it.
Mhm.
And
So,
the other thing is that the technology, the messenger RNA technology, is so good that if they find a new strain, they can make it pretty quickly now. They can see what what's the genetic makeup of that virus, and they can make a new vaccine quickly. Because the technology is very, it can make vaccines pretty quickly with that technology.
mhm. And these are the numbers from CDC, that 9547925. Oh, that's a big number. About a million, I guess. Those distributed, and people who have already initiated or got the first dose. I mean, that's a huge number too. So
Yeah.
I think it's gonna be a race against time, in that sense, that we really have to vaccinate a lot of people, and then to get herd immunity, right?
Yeah. So my estimates were that, suppose, I mean, we're gonna get rid of COVID-19, and eventually it'll go away with time. But if it's affected our way of life, how we like interact socially that we used to do, our economy, our schools and colleges. So Eventually, it'll go away, but it will cause a lot of damage if we don't have a vaccine, right? It might take like 2 years to go away with the current rate of infection. It may take 2 years, but with a good vaccine, and if you get vaccine, I mean, if we vaccinate everybody in like 70% in 6 months, then we have control of the virus and we have our way of life back, and we have a lot less deaths, if we have a vaccine.
Yeah, and these are the, as you were saying, it does, affect on a lot of our, social life as well as economy, of course. And so those are the basically some of the graphs I'm showing from maps and charts provided by CDC.
Mhm.
Main thing is, how I don't think, of course, lockdown can only help for temporary. It's not the answer for all the time. We can't have lockdown completely for a long time. So we have to. I think we are fortunate that we have vaccine, and I know it's technology is new. There might not be a lot of cases in terms of. There are human trials which were done, of course, to get the emergency authorization, but we don't have a long-term studies, right? So we don't have those, and but I don't think we have a choice. What do you think? We have a choice to wait and then do, or just go ahead and do the shots?
Let me tell you something that for any new drug, if you have a new drug in the market, there are no long-term studies, right? Because it's
Yeah.
kind of new, and it's a new pandemic. It's a new strain of virus. Anything you do will be new. All the antivirals will be used are new. All the monoclonal antibodies that you will use are new.
Hmm.
So you have to do trials to find out. Now the thing is that some people were saying that why doesn't that the FDA approve before phase 3 trials? A lot of scientists to start vaccinating before the phase 3 trials. So I think the good thing is that the FDA waited for the phase 3 trials to finish because they knew before the phase 3 trials, which were
Hmm.
done in 30 to 40,000 people.
Hmm.
That's a lot of people to check, and these are double blinded, in which they give a placebo to one group and they give the real vaccine to one group, right?
Hmm.
So before the phase 3 trials, they had phase 2 trials which show that the vaccine makes good antibodies against corona, against the virus, right? So they could have given authorization then, but we still waited for the phase 3 trial to make sure the vaccine is safe. So I think that we didn't have for the FDA and the ACIP and the VRB, the Vaccine Related Biological Products Advisory Committee, which are independent bodies. They also looked at this and they look 8 weeks of safety before they approved this, EUA. It was not just said, okay, we have a vaccine, let's start vaccinating people, but they did would take their time doing it. So I think we might we will continue to monitor. So now we're in phase 4, which will be tens of thousands of people that get vaccinated. Some
Hmm.
people might have a very rare like anaphylaxis, like a reaction or a severe allergic reaction, which can happen with any vaccine. It can happen with the flu. It still happens with the flu vaccine, but we still take it, right?
Hmm. And and that is a good point, that allergies happen with everything, even with food. I mean, some
Yeah.
people are allergic to chocolate, some are allergic to everything. I mean, that's human body. You cannot be perfect on determining what effects it'll have or what side effects somebody have from medication. But we have to take precaution. I think there was a physician, he had EpiPen. When I got my shot, I was carrying my EpiPen with me too. So just in case, if you have an unexpected reaction, you can just, get a shot. Right.
Yeah, I mean, a reaction can happen with anyone, like anaphylaxis, with any medicine that you take. So usually, when you will get your medicine, you'll be in your doctor's office, or you'll be in a controlled environment where they would have EpiPen or they would have anything that would happen to you. And
Mhm.
so far, the patients who had the severe reaction, they've been fine. I think one patient had to be hospitalized, two had to be hospitalized, but they were treated and they were fine afterwards. But most people, the side effect, the severe reactions are very low with the Pfizer phase 3 trial, which is available online. Actually, you can see all they've been very what you say, transparent, because they released the whole phase 3 trial, and you can find it online and read about it. So the severe side effects were less than 1%, were very low.
Mhm. So the side effect which I experienced and which is very similar to a lot of people have posted is that soreness, local, maybe mild muscle ache, and then it just lasted like you will get from flu shot. So I just
Mm.
took Tylenol and that's about it. There was no fever, nothing. No change in my activity whatsoever. So which is great news. Now, the other misconception a lot of people have, and I would like to ask you, is that there was unfortunately a lot of media disinformation, I would say, out there,
Mm.
about vaccine. And number one is, they were saying, don't get that, you'll develop this or that symptom. Then I just saw a video which suggested that somebody take the vaccine and then they get these virus COVID-19 actual exposure, they might develop a severe reaction somehow. And they quoted some trials from earlier vaccine trials on SARS as well as RSV virus. So they said they tried earlier vaccines. I don't know the details, but they said when they were exposed to wild virus,
Mhm.
somehow it triggered hyper response in those individuals. Do you think that could be a possibility?
Well, so far the trials have shown, that the vaccine has been safe, and people who were in the vaccine group had COVID, had really mild symptoms, and all the patients, or anyone who had severe symptoms, were in the placebo group, in the trials. So trials showed they were safe, and also the trials showed that people who had, had some antibodies, which were like not many, the vaccine was safe in them too. So
Mm,
if you had COVID before and you got the vaccine just to boost your immune system,
mm,
they had no like severe reactions.
mm,
So
mm.
anything that's in the media might be, I don't know how to, or in the social media, if there's some kind of reaction, we need to investigate it. But there are a lot of things that might not be true.
Yeah, and look at the numbers. If we have given what 1 million, close to that numbers already got the first dose, I'm sure a lot of people might be exposed to some of the, might be exposed, but we haven't seen any reactions, major.
So that's why we have the phase 3 trials, and this is now in phase 4. So they really look very carefully at safety of the vaccines in phase 3 trials. So I think that so far I've known that somebody told me that 1,000 healthcare workers got it, and they've all been fine with no major symptoms. So we're just so far, like, you got it, you feel okay.
Yeah,
So
yeah. Yeah, I posted on social media. I wanted to encourage everybody to get the shot, and so this notion, and a lot of my patient and not which are not my patient, the people who knew me, they came and they say, oh, that makes sense. We'll consider taking the shot, which is great because that we want to encourage people to, because if we took the shot and we are doing well, then everybody will be too. There will be some reaction, but as long as we are careful, we should be fine, right?
yeah, most of the reaction is, what they say in the trials is your body's reaction to mount an immune response against the antigen that's going to make against the parts of the virus like spike proteins. So like the fatigue that you have, the chills that you have, those are good signs actually that your body is making an immune response. And they say you usually get it more after the second dose than the first dose. You might have a headache, you might have fatigue, you might have some chills. So that's a good thing actually, that your body is fighting against those proteins that part of the virus that your body has made, so that you have immunity. So if you have a real virus coming into you, your body can fight it, and you don't get the really bad disease, or you don't even get the disease. So So that's a good. That's not a bad thing to have some response.
Hmm. So what you're saying is, if you get some of the symptom, it means your body is responding pretty much
Mhm.
the way it should be, right? So you don't have to worry too much, right?
Yes, yes.
Okay. So the other thing I want to ask you, what do you think we can do better to educate people, to get the shot?
Well, there are many resources. You can go to your state health department. Every Maryland health department has resources about COVID-19 vaccines. And then the CDC is an excellent website which has details about what kind of vaccines are there, what are in the pipeline, and what's the different phases, of and installments are going to come in. So that's very important. You can hear in the news, I think all the channels are showing about, you can hear from the NIH, Dr. Fauci, who keeps on advising. Our President Biden has taken it, the Vice President has taken it, the vaccine. Dr. Fauci did live on television. So these are all encouraging other people to get vaccinated. So they'll give you the real information. So as I said, that if they're these are part of any new drug or for any new vaccine, uh, there are independent bodies that will be monitoring, vaccine for any side effects or any serious reactions. So now we have thousands of people vaccinated, and so far, it's been like, really safe. I would encourage, you can talk to your your physician. That's one source. Your physician, your healthcare provider. Talk to your friends who've got the vaccine. Dial into Dr. Moby's lifestyle channel.
Hmm, yeah,
So that's
thank you.
one that's one source too, right?
Yeah,
The social
thank you.
media. Yeah. Yeah.
So that definitely, plays. There's a lot of is education, social media. Yes, I'm disappointed on some of the social media. They're promoting all these conspiracy theory, and then people telling things which actually never exist. So I'm disappointed. I mean, they should ask us. I mean, they should ask you. They should ask us, healthcare providers, to give opinion. And some people, just to gain some fame, they promote these theories, and this is sad. Other thing, I think you had shared with me some of the, you know off-label use of certain techniques, and I loved it. I have practiced some of that. Hand washing, of course, is proven to help. Wearing masks helps keep more than 6 feet distance helps.
Mm-hmm.
um, what else you think using a saline drops can help if you have some exposure?
Yeah. So let me tell you, there's some literature and in the lab as well as in the different randomized community trials. There are not many studies. So I've been exploring this option as a community treatment for prevention, for prevention and early treatment of COVID-19. And there are some randomized trials looking that showed that if you do nasal salt water nasal irrigation or salt water goggles, and then you can help to prevent upper respiratory tract infection from viruses. So those studies are basically done in non-pandemic viruses like common cold viruses, but there are also some evidence in like case control studies in which they had like you had an outbreak in a hospital in China. So they found out that when people who like the healthcare workers who rinse their nose with water, or they had less chance of getting the SARS virus, the previous SARS virus. So I made this protocol, and I've been doing it. So and I have some of my friends have been doing it, and some of the people that I know, some patients who could do it during early treatments, I advise them to do it. So they've been doing it, and all of them have gotten better, or they have not gotten infected. So from the virus. So like I've been around people who have a lot of coronavirus, So I'm suggesting that, it's a scientists that who are doing studies, they study this protocol which I made, and I'm trying to
Mm,
publish it, and it's based on Ayurvedic medicine. That's right, but there's now a lot of science behind it, and the science is that the saline, the chloride ion in the saline can go into the cells when they have active infection, and it can form like hydrochlorous acid. Well, hydrochlorous acid is same as bleach, so it goes and kills the cells, kills the virus, sorry, in the cells. The other thing that saline does, and that's very well known, is that it improves your mucociliary function, and the mucus that plugs into your nose and your when you have a viral infection, it clears it up, and your cells kind of clear the secretions, and the cells move better, the cilia move better, the hair like things that you have on your cells, and helps to clear infection.
mm,
So I'm trying to promote that as an early strategy in the household, and also like healthcare workers can do it. And what I did, I including hand hygiene, hand washing. I asked them to people also to wash their face with soap and water, because what we do is we always touch our face. We are habitual, we touch our nose, our face. There are studies showing that students, if they made a vid, they did a study making a video on students, they touch their face 23 times in an hour, like their face, and they touch their eyes, they touch their nose or their mouth, also like during the parts of the face, But that's another. There are two ways of this virus to be transmitted. One, the main is respiratory droplets. You're close to somebody within like 6 feet, then you can, and somebody's even talking or sneezing, or somebody's also like singing. And it's within 6 feet for you for more than 15 minutes. It doesn't have to be together. It
mm,
can be, according to CDC, could be like separate times. Then they can transmit virus to you, and
mm,
like they are with in terms of respiratory droplets. So the virus, how do they get this? One way of getting the virus. Other way is through touching. Like you touch a knob, or you touch, like
mm,
you shake a hand with somebody, and then you touch your face, or you touch your, transmit it to your nose or mouth, and that's where it starts replicating. So your mouth and nose are the primary sites of replication. If you do like a PCR, an initial infection, you'll find millions of copies of the virus in your nose and your mouth, even before you get symptoms. So just remind you that this virus spreads usually 2 days before even you start having symptoms. You're shedding a lot of virus. Virus is through the eyes. There are like some indirect evidence. It's not a common site of infection in the eyes. Some people have said that 1/3 of the people might have some eye symptoms, but usually people don't have eye symptoms. But the conjunctiva is like open mucosa. So
mm,
to the so what can happen is that like it can go from the conjunctiva from your eyes the eyes connect to your nose through a duct known as nasolacrimal duct, so it can go from your eyes to your nose and start infection, in your
mm,
upper respiratory epithelium. So I wrote this protocol kind of. I think I shared on social media. I'm trying to publish it also. As I said, that I've been doing it since the part of the pandemic, and I've been in major outbreaks. Yeah, I work in the hospital too, and my testing PCR has been negative, and my antibodies have been negative. So a friend called me who was doing it on my advice from Las Vegas, and he said that all his cardiology group, 6 out of 5 are positive, and he's the only one negative. And the only different thing he's been doing is that he's been doing this soap and water for washing hands, as CDC says, and also washing his face and doing the salt water irrigation of his nose, and also gargling. So
mm,
the technique is very simple. You have to either you take distilled water, because that's the best thing, because it doesn't have any infection in it. Because the risk of some, if you take tap water, or you take or water contaminated with like amoeba called as Naegleria floweri, and it can cause infection in the brain. So there is very rare disease, but it's lethal. So in the so what we recommend is you take distilled water. You can take it from the market, or you can you can boil water for 3 to 5 minutes, like tap water, and it will kill any kind of bacteria and let it cool down. You can take 1 teaspoon of sea salt and put in a cup like 200 ml of water and mix it. You can make it at home. There are also commercial preparations you can buy for nasal irrigation. So what I usually do myself, you can sniff it in your nose, and what I do, I first wash my hands with soap and put it on my face, and I wash it with water 3 times, and then I gargle with that solution 3 times. Then I sniff it in one nose, and then do the other nose 3 times. And you sniff it in, and it goes back, and then you let it out, and um, then I use some more solution in a separate cup and do one eye. Just flick my eye in the saline water, and do the other eye. But you can also use a saline spray, or you can use a nose spray. That's kind of easier if you want to do the eyes. You can skip the eyes if you want to. And I was recommending to do the eyes for people who have in large gatherings or healthcare workers. So you can do this for prophylaxis, like 1 to 3 times a day. And what I found out from the studies was that the person who did the study in London, he did it. He has a video, and I will put the link in. He did it like when he had initial infection. He used to for any like because this starts with the upper respiratory tract infection. So he does it like 12 times a day in the beginning. For just he did just gargling in the nose only, and so to get rid of the virus. So they also found out that people who did it, they had less symptoms of upper respiratory tract infection. They got better quickly, and or even the household members got less sick. But I would recommend that you clean with like bleach or any Lysol, your sink and everything. Make sure you don't share your utensils. Because you use all the proper precautions. Wash if you have a small container using it, wash it afterwards. So it's something I'm trying to I'm trying to publish and also try to promote, because we don't have anything for early disease. We don't have any drugs. We don't have any intervention, right? Like an early mitigation strategy, like a
Yeah.
house strategy to prevent the disease from getting worse, in the
Yeah.
beginning, right? Yeah.
Yeah, prevention is always, the bigger winner of always. So if you wear mask, if you wash hands, if you stay distant, and don't stay in the room more than 10-15 minutes if you have too many people there. Those are, in my opinion, simple steps, but very effective, very effective. I mean, we see patients all the time. And I try to limit my encounter to 15 minutes maximum, with the COVID positive patient, because the more time you spend, probably you will get bigger dose. So this helps. Saline will help. Washing eye, I missed that. What did you wash eye with? Soap and water, just a regular.
No, what I just put that part in like for healthcare workers or for people who are in like large gatherings, or people who um, uh, had exposure to somebody. So actually, what I found out, I was researching this topic. So I found out that we had the Chinese outbreak
Hmm.
of COVID-19 in China. So the Chinese has there's a Chinese hospital, affiliate hospital, which put in these guidelines, and they were available at Alibaba online. You can check it out, handbook for COVID-19 treatment from in China. And in that handbook, they have different guidelines for healthcare. They have a whole what they do if how to wear PPE, what to do if you have exposure. So in the guidelines, in Chinese guidelines, I found out that that if a healthcare worker is not wearing goggles, right? So they are told them to with normal saline flush your eyes. And also I found out that suppose a healthcare worker is not wearing a mask and he goes close to a patient with COVID, he doesn't realize it. Then the Chinese guidelines say then gargle with saline in the guidelines. So what I I found like some studies. They were one study in children. They used a spray in the eyes. They did saline flushes and spray in the eyes. And another study in and the one of the studies which is called Elvis study from London, Edinburgh, in that study that I contacted that I emailed that author, the primary author, and he told me that he recommends to put your eye in a small, put some fresh saline in a small container and then flick your eye three times. So it flushes any virus in your eyes. And there's some salines that has active.
Mm. So okay, so that, yeah, so saline has to be dilute. Normal saline, uh, is I able to handle that, or should we dilute?
Basically, the solution that I'm making is hypertonic saline. It's like a teaspoon in 200 ml of water. So it's 3% saline. So it's called hypertonic saline. The eye might have a little bit burning in the beginning, but then it's usually fine. When in the beginning of the epidemic, I was doing too much of it, so my eyes weren't really red. I was scared. I was doing like multiple times a day. But now when I do it one or twice a day, it doesn't burn at all. So this saline is used for you have chemical burns in the eye, so it's used. Normal saline is used. But what they found out that in the lab, if you put saline in cells like even for influenza or herpes simplex virus or coronavirus in the cells, and you put saline, it kills the virus in a concentration dependent manner. So hypertonic saline is better than normal saline, and there's a meta-analysis in which they compared different studies. They found that hypertonic saline had more benefit than normal saline in relieving upper respiratory tract infection symptoms. So it's shown in the lab, it's shown in the meta-analysis that the more saline concentration you have, if like saline, like if your 3% saline is you kind of is bothering you, like with then
Yeah.
you can like use you can use a less concert. You can make it 1% or 2%, so that's okay. As long as
Mm.
you do it regularly, and but the purpose is to do it early in infection. Or suppose you have a household member who has COVID and you're afraid that you might get it, right? So you can start doing it prophylactically. You have a household member, you can avoid contact. Or they're in isolation, but there's a family outbreak of COVID, so you can do it in the household. People who don't have it, or people who are asymptomatic now and they might be still have a small some virus in the body, in their mouth or nose, you can start doing it. So that's how it can be helpful, I think.
Mm. Mm. So yeah, I mean, nose is very easy. I mean, I think so. I have the saline mist, and I've used that. That's really good. You just pump it; it just blows a lot of saline mist. And this commercial product,
Yeah,
uh, easy to use. Some have soda bicarb with it too.
yeah,
So you can use them. I think pretty good.
yeah.
So
Because my friend who did it, he got a commercial product in Las Vegas, a cardiologist, and it came in packets. It had bicarb and salt in it. And this is something I thought I never knew about it. How much is used in the United States, but I found out that in the University of Wisconsin Madison, there's a lot of primary care family physicians do prescribe saline integration for upper respiratory tract infections, and there have been studies done by Dr.
yeah, I mean, yeah, I
Robago in University of Wisconsin Madison. If you Google University of Wisconsin Madison, yeah,
mm, mm.
yeah.
Okay. Well, thank you for
And the technique that they use is neti pot. It's a
mm,
neti pot. It's a small pot. Actually, I have it. I should have brought it. I bought it to see what it looks like. So you can it. What you do, you put it in one nose. You and yeah, drains the, yeah. Okay.
Mm,
Got
mm,
Yeah. You put in one nose and it drains from the other side, and you do the other nose and it drains from the other side. It flushes, it kind of everything that it also good for allergies and chronic sinus conditions. So you can Google University of Wisconsin Madison and nasal irrigation, that technique.
mm. And so, thank you for extensive discussion on COVID. I think I had great education
Yeah.
for our audience. Thank you, and clarifying a lot of myths about it. So, final message is, stay safe. Prevention is always better than cure. Remember that. So if you do, wash hands, wash face, if you want, and you can use salt water and keep your distance and limit your encounter if you have to. That's all. I think is a basic guideline. I would say, and take vitamin D, zinc, whatever you like. You make sure some studies show it helps. So please take that. There's no problem by taking it. So those are good things. And then get the shot. Get the shot. And then, God forbid, if you still get worse or you catch infection, of course, then seek the care. Do not delay. So, any final message you have for my audience, Doctor?
No, thank you. Please stay safe. I know January we have New Year's holidays are coming, so all those, as Dr. Moby was saying, social distancing, wearing mask in public gatherings or with a lot of people, washing your hands. As CDC says, with soap and water. Do not touch your face. The CDC web. If you go to CDC webpage or hand hygiene, tell you when to wash your hands or use the alcohol-based hand hygiene when you like go into the shopping market and you touch trolley, you clean your hands. So before you make food, during making food, after you make food, so it gives you all those guidelines to see, to when to do those things, and these are very important because we just take them for granted. But these are small things that can help us from prevention, as Dr. Moby is saying, from getting infection.
Mm.
And try
And
to
so,
get vaccinated. If you get sick, try to do saltwater goggles or nasal irrigation with the clean distilled water if you can do it.
Mhm.
So just take care and hope you have a nice holidays, and thank you for inviting me to your talk.
Okay, thank you for coming and stay safe and have a nice new year. Hopefully, we get control on all this. Take care. Thank you. Thank you.
Thank you, Dr. Moby. Thank you.